Hey everyone, it's Wednesday, time for Wisdom Wednesday. Hope you all are settling into the new year and all is going well. Took a week off last week and so we're back this week, and I just lost a friend recently to metastatic melanoma, and I thought maybe I would review a little bit about skin care and observations of moles and things that can happen to our skin. We've talked a lot about other forms of cancer, breast cancer, prostate, etc., and the fact that oftentimes cancers occur in an environment where there is poor immune health. And as you know, and we've talked about, we all make cancer cells every day, but in terms of having a system that is operating well, a robust immune system will go around and clean up any of this DNA cellular damage and prevent excessive growth. Well, we know that melanomas arise in the skin. We know that it's a type of skin cancer that is formed in the melanocytes, and these are the cells within the skin that give us our color. And we know that UV light, ultraviolet light, can affect our skin and has some direct effect. We don't know exactly what causes melanoma by any means, but it's certainly these melanocytes that grow unchecked, and they've had DNA damage and they just continue to grow without being cleared by our immune system. So when we're growing up, we know that all of us have some moles that we see on our skin, and usually by the time we're adults, we have somewhere between 10 and 40, and people who have more moles tend to have a higher risk for melanoma, and they certainly can occur in moles that we see. But it's also possible to have areas of the body that can develop melanoma where it's not even seen by the sun, or it's not even seen by us. It can occur in the eye, it can occur in the mouth, it can occur in any orifice in the urinary tract, the digestive tract, the vagina. It can occur under nail beds. So it's possible to have these types of cells, these melanocytes, grow in such a way that they can cause untethered growth and set up a situation where you can have disease that then spreads and can cause all kinds of damage. But when we're looking at moles, let's just say when you are checking yourself out or going to a dermatologist, the things that we're looking for any type of asymmetrical growth. We're looking for an irregular border. We're looking for any change in color, any change in diameter, or something that's evolving, or the A, B, C, D, E, if you will, these types of way of thinking about what could be going on with a mole. So A is asymmetrical shape, B is an irregular border, C is anything that's changing colors, D is enlarging or increasing diameter, or something that seems to be changing over time, that evolving. So A, B, C, D, E, something that you can kind of hang your hat on and something to look for when you can examine yourself or your loved ones and look at the skin, or certainly if you have a professional checking you out. These are things that we look for. But again, like I said, there can be hidden cells and hidden areas where these can occur. So it's important to have someone check these areas that are not necessarily seen by you. And when you're seeing your gynecologists, females or men, when you're seeing your physicians, they can check some of these areas. And even though they don't really present necessarily with any symptoms, it's just good as we age to have these skin checks done. And again, since we don't really know the causes, we have to look at risk factors. And we know that people with fair skin have a higher incidence of melanoma because they have a problem managing UV light. So getting out and having multiple sunburns as you are growing up, or even at this stage of life, that can be a problem. A history of sunburn can be a risk factor. We know that folks that live closer to the equator who are exposed to more sun have higher risk. Now, it's not that we don't want you to have sun. We do want to get good vitamin D levels, and that's why it's important to kind of get sun in times of the day where it's not particularly really harsh on the skin or in short bursts of time and not long periods of time. Having many moles or unusual moles puts you at risk. Having a family history can put you at risk, and then certainly having a weakened immune system can be a problem. So just knowing ways that you can increase your immune system, and we've talked about that ad nauseum since we've had these 2 or 3 years of COVID around. And so it's important to do all the things that you can to optimize your immune system. Eat well, stay away from sugar, stay away from inflammatory foods, get good sleep, exercise, try to manage stress. Stress is a huge issue as far as dampening our immune system. And how to manage stress, deep breathing and doing high intensity interval work where you lower your heart rate so that you have a tool in your toolbox, so to speak, to help keep things kind of calm under the waters. That can be very helpful. Meditation and yoga practices can be helpful because of that deep breathing. So helping to manage your immune system, and if you have a weakened immune system, to really look at that and look for ways that you have control over trying to keep that immune system buoyant and in a good place so that you can fight these things when things come along. We know that this time of year is challenging from a stress standpoint, and even our moods have an effect on our immune system. And it's interesting, there is some data that depression comes before even a cancer diagnosis. So having severe depression, now we don't know necessarily what comes first, the chicken or the egg, but depression itself may be a warning sign. So just so that you know, these things that can affect our skin, it's important to have someone look at your skin, that you have your skin checked. We can certainly do that here, but a lot of folks obviously will see specialists in this area, dermatologists, and just look over anything or have someone evaluate if you suspect any problem at all. Hope you all are having a good week and you all are settling in, like I said, to the new year, and we look forward to continuing to look at ways to optimize our health, and skin health is certainly one of those things. It's one of the biggest organs we have. You all have a great week, and we'll talk again next week.